Okay, so this one is a two-parter. So Dr. Sarah Sims is going to do a presentation first, and then together with Dr. Mezei, they're going to do a panel afterwards. So it's going to be like a quick change. So this is the first time that Dr. Sims has joined us. She is a clinical instructor in physical medicine and rehabilitation. It's too many syllables for me. In rehab at the University of British Columbia and GF Strong. And Dr. Mezei, who a lot of you in this room probably know because you see here at the Adult Metabolic Disease Clinic. She's a clinical professor of neurology, also at the University of BC, and a neurology consultant at the Adult Metabolic Disease Clinic. It's all yours.
Hello, everyone. So thank you for the introduction. I'm Dr. Sims. I was a physio before I was a physiatrist, so hence the MSCPT behind my name as well. I tried to include content in this slide, which I'll try to keep under 20 minutes, so there's lots of time for questions, but directed towards the questions that we expected to be asked. So if there's any questions that come up as we're going through, please feel free to interrupt me. I was going to review some of the general benefits of exercise, some different types of exercise that you can do that work different body systems, some general exercise prescription recommendations, and looking at just a couple fatigue management strategies, as well as some resources that are available. So what even is a physiatrist? Probably a number of people in this room have not heard of physiatry before. Physiatry, so it's the same as physical medicine and rehab doctor, sometimes called physio doctor. We are a smaller specialty within the division of medicine. We tend to take a bit more of a holistic approach with a target at looking at general function and how we can have a holistic approach at improving function and tailor a rehab program to that. Visits with us would often include general education, including on exercise management and prescription, looking at mobility, gait aids, pain and fatigue management, looking at orthoses and equipment. And we often work quite closely with other members of the rehab team, including physio, occupational therapy, speech-language pathology, our neurology colleagues, and you as the main member of the team. So what is exercise? Exercise is any activity requiring physical effort that is generally carried out with the goal of sustaining or improving health or fitness. It involves an interaction of multiple different systems in the body. So that can include your cardiovascular system. So that's going to be more your heart and your lungs to be able to provide energy and oxygen to the contracting muscle that is working with exercise. There's different types of exercise that we'll talk about. So things like aerobic fitness are often more so focusing on that cardiovascular system. Strength training, which is typically more so looking at muscles, the larger muscle groups within the limbs, in the hip girdle, in the shoulder girdle, and core stability type exercises, which may often actually be a very helpful and underappreciated part of an exercise routine. There's lots of benefits of exercise in general, and in particular in different types of myopathy. With exercise, we can see improvements in muscle strength. So probably anytime you come to a visit or see someone like Dr. Mezei or myself, part of that exam is going to be looking at muscle strength in many different muscle groups. So with exercise, we look at trying to improve that isolated ability to contract and see muscle strength. We can also see improvements in aerobic fitness, reduction in fatigue, better quality of life, and generally improved function. In addition to that, there's a number of other benefits. So you might notice reduced musculoskeletal pain, improvement in sleep, improved mood, and then lower risk of other types of health conditions such as diabetes or hypertension or even types of cancers. And so with exercise, we can see changes at the muscle level. So we can see you can't change the number of muscle fibers that you have with strength exercises and conditioning, but you can see changes with the size and increase in size of the muscle fibers. increase in the amount of blood flow that goes to those different muscles that are working, and increased efficiency in that muscle to be able to utilize the oxygen. In the opposite direction, so while we have improvements with doing exercise, you can also have kind of changes in the opposite direction with more sedentary or lack of exercise. So in general, it kind of is pretty much the opposite in terms of the benefits that we see. So with lack of exercise, we can see accelerated muscle weakness and atrophy, reduced endurance, reduced general fitness, increased fatigue, and reduced capacity for daily activities. So how about exercise in Pompe disease? There's a number of studies that look at exercise as a treatment modality in different types of myopathy. There's a couple specifically looking at Pompe. I would say one thing that I was reading about as a general kind of statement and recommendation is that exercise prescription should be part of a routine neuromuscular care for patients with myopathy, and ideally input from a multidisciplinary team with focus on providing an individualized program. When we're specifically looking at some of the studies with Pompe, generally the recommendation, and we'll probably repeat this a couple times, is that an exercise program should be individualized to you. There's no kind of one size fits all for exercise. I think when you're trying to get started, you might use some resources that take more of a one size fits all approach as like an entry point to be able to start doing exercise, but then it's always helpful to have that tailored to the individual. From this study, it generally recommends in Pompe having an exercise session that is multiple different types of physical activity. So within one exercise session, including aerobic fitness, maybe take a break from doing aerobic fitness, do some strengthening type exercise, then maybe switch, do some core type exercise. And we can talk a bit more about some specific parameters for things to try to work up to and target with that. So first, strength exercise. So probably I feel like a common question would be, is it safe to do strengthening exercises in myopathy and in Pompe disease? And the answer is yes, it is safe. There's some things to take into consideration in terms of, with the biggest risk, making sure that you don't unintentionally do excessively strenuous exercise. So following some of these recommendations and parameters can be helpful. So again, coming back, individualized, ideally supervised until you're feeling a bit more confident in terms of doing these exercises. We talk about different types of muscle contractions. And in general, in myopathy and Pompe, we would recommend isometric and concentric exercises. So what that means, an isometric exercise is where your muscle is just holding a position, either against gravity or perhaps against a low weight or a heavier weight. Concentric exercise is if you think about something like a biceps curl, the concentric component of that exercise is as you're pulling up, and then eccentric is the other type that we would generally try to shy away from emphasizing in Pompe. Eccentric would be that slow, controlled release against gravity in a stretching position. The reason that we would try to kind of stay away from more of the eccentric exercises is we actually see a little bit, there's much higher power and forces that go through the muscle in that slow, controlled lengthening of the muscle than the concentric shortening of the muscle. Would generally recommend starting with body weight exercises and low weights. And one recommendation that comes up quite a lot is that the intensity should be submaximal. So figuring out what that submaximal means for you specifically with strengthening exercise would generally be initially targeting kind of a 5 out of 10 level of discomfort with doing the exercise. Ideally not pushing it up into that, 10 out of 10, I have done my 1 rep maximum, I cannot possibly lift anything heavier than this. And I think the key would probably be start actually maybe with your kind of even low to moderate maximal amount of output. So trying for that kind of 3 to 4 out of 10 and see how your body responds to that. So if you find that you have delayed muscle soreness for more than 2 days afterwards, that might be an indication that you have overworked the muscle, and it would be helpful to reduce how strenuous and how much effort you're putting into that exercise. So aerobic exercise is the type of exercise that we do to try to get your heart rate up. This can be done in a number of different ways. And if we think about the heart and the cardiovascular system as kind of like an engine or a motor in a car, I don't know that much about cars, but I know when I watch that if I'm pushing myself up a hill, I rev into a much higher kind of red zone. So if we're wanting to see changes with your cardiovascular capacity, we want to try to push up into that red zone for periods of time, again, still in that sub-maximal effort, but out of that kind of low revolution, low effort. So sometimes I think there's a lot of focus that goes into walking being a really good cardiovascular exercise. And that is true, as long as you feel like with walking, you're able to adequately get your heart rate up into that zone that we're trying to target. When there's other elements to consider in Pompe, such as maybe changes in balance, changes in muscle strength that make it more difficult to get your heart rate up, with walking, it might be helpful to consider alternatives, such as sitting in a recumbent bicycle, cycle ergometer, so using your arms to try to turn the cycle wheel and getting your heart rate up. Again, looking for that moderate and sub-maximal effort. So again, kind of 5 out of 10 on that effort scale. And then often we say, you can still hold a conversation with somebody, but you're not able to sing a song. So that's kind of the level of effort that we're looking for with the aerobic exercise. 30 minutes, 3 to 4 times per week would probably be something to work up to. I wouldn't expect if aerobic exercise was new to you, I would start lower than that and gradually increase over time. And then likely, as we'll talk about in a couple more slides, incorporating that also with strength-based exercises. Core stability. So core stability is when you're focusing on those smaller stabilizing muscles within the abdomen or in the lower back, hip girdle, even the small tiny little muscles in your shoulders I would consider part of your core. Having a stable core allows you to be much more effective with using your larger moving muscles in your limbs. If you have a more stable base, it's much easier to do things even like sit unsupported. It's easier to do things like sit to stand or very functional exercises. And so it can be very helpful. I would start with some lower length of time for holds, so 5 to 10 seconds, and try to work on more repetitions. I've kind of linked a resource at the end with a couple, it's a PDF that has a number of core type exercises that are actually a specific recommendation for Pompe from the Muscular Dystrophy Association. So those would be good resources to look at in terms of how you choose what kind of core exercise you're doing. I think when we think of core, we often think about doing things like a plank. I would never recommend starting right with a plank. I would modify that. I would look at considering, a plank against the wall if that's accessible to you. Being in this kind of position here with a dog on your back in a tabletop. And then essentially just trying to find a place where you feel that sort of 4 to 6 out of 10 difficulty with the muscles that you're trying to work. So when people come in to the doctor and they have high blood pressure, we often give you a prescription for, your Ramipril or whatever antihypertensive medication. I think it's helpful to think of exercise as something that we prescribe. If you don't take Ramipril for your high blood pressure or whichever other medication, then your blood pressure is going to creep back up. The intention for exercise is it's going to be something that you continue to do on a regular basis as if it's a prescription for a medication. This is a general recommendation of an idea of how much exercise you want to try to work up to in a week. So 2 to 3 sessions per week, at least 1 day of rest in between. Again, emphasizing that moderate and submaximal load. This resource that I had looked at said 50 to 70%. Again, I probably wouldn't push right up into that feeling of a 7 out of 10. And just to be very clear, when I say the 5 out of 10, 7 out of 10, I mean 0 out of 10 is you're not putting any effort. This feels you're not kind of exerting yourself at all. 10 out of 10 is maximal effort. You cannot have a conversation. You cannot possibly do any further. And then we use this scale to just try to have a quick and easy guide for how to prescribe exercise. Looking at the types for strength training, can be helpful to do multi-joint resistance and functional exercises. So that might look like things like a sit to stand, a leg press, those kinds of combined movements, and then including those core stability exercises as well. And then often combining this with your aerobic exercise. Generally, maybe the full session lasts 45 to 60 minutes. And when we're talking about repetitions that we typically recommend for strength, we say 8 to 12 repetitions, 2 to 3 sets. So one question that comes up is, when should you see a physiotherapist? A physio is someone who can be very helpful to see when you have a very specific goal-based question. So you have a new shoulder pain. What are some exercises or strategies or management that you can do to address this specific issue? I think if getting into exercise is something that is new, it can be helpful to see a physiotherapist to develop an initial home exercise program that you can do independently. That's part of that, making it more individualized to you as a person. And then a point to kind of touch back with a physio would often be, okay, I've mastered these exercises. I want to make them more difficult. How can we adjust them? Can you review how I'm doing them? That could be with a physiotherapist or a kinesiologist. And typically in terms of ways to access a physio, oftentimes that would be through a private clinic, or each health authority is different in terms of what physio and allied health resources are available. Occupational therapy is another allied health member that can be helpful. They are going to focus a bit more on your general activities of daily living and can be very helpful in education on pacing and energy management strategies. Helpful in looking in mobility devices and gait aids, and similar to physio, options are typically private or whatever happens to be available within each health authority, which does differ health authority to health authority. So helpful to kind of touch base with your family doctor or other physician in your care. So a couple tips of things that you might talk with your occupational therapist about, and that came up earlier. I know people have referenced a number of the strategies that we generally recommend for fatigue management, but you can use the 4 Ps to remember. So fatigue is a very common symptom in Pompe. It can be both physical and mental. Fatigue is multifactorial and can be related to muscle level changes, and then can often be influenced by many other factors. Those would include sleep, mood, maybe medication side effects, and levels of physical activity, as we talked about before. In terms of the 4 Ps, you've got pace. So that's considering the pace that you're doing something at. So taking your time, planning things out, not trying to rush. In general, sometimes people can experience a bit of like a crash and burn. So if you push yourself really hard, then you might have a big drop in your energy levels. That's related to pushing and crashing. We also want to consider prioritizing. So looking at the activities that you need to do, which ones are the most important, and then you allot more time, or perhaps you choose not to do in one day the things that are not as important to you on that priority level. Planning kind of goes in hand with that prioritizing. So organizing your schedule, on the basis of the things that you are prioritizing. And then position is being mindful of your ergonomics while you're doing things, and that you're not, unnecessarily using energy to do things in, like when you're picking something up or you're lifting and you're bending over with your back instead of using your stronger, bigger muscles in your legs. So things to watch out for anybody, not necessarily related to Pompe. If you start exercising and you develop new chest pain, that is generally something that we can be concerned about. Increased shortness of breath that does not resolve with cessation of activity, or very, very severe new onset of shortness of breath. Unexplained fainting and dizziness spells, or new heart palpitations. Those are reasons that you would want to see probably an urgent care or even go to an emergency department for assessment. In general, we also would recommend monitoring for signs that you have done overworked or done too strenuous activity. So that would be excessive fatigue that does not resolve with rest after exercise. Increased muscle pain that does not resolve with adequate rest within 48 hours after exercise. Or new weakness that follows exercise and does not improve. So these are a couple of resources that I found with putting in the Google prompt Pompe exercise recommendations. So the first one that came up was actually a really nice PDF. It, I think, is a pretty great starting point for primarily for the strength-based exercises and core stability exercises. I think it was 11 pages long through the Muscular Dystrophy Association, free PDF. There's a number of variations of different types of exercises that fit all of these categories that we've talked about in terms of core and general strength. And then also the Canadian Association of Pompe, just reading through some of the recommendations on staying active. So when to see a physiatrist is also probably a good question. We work with lots of different populations. So we have an outpatient neuromuscular program at GF Strong. We see a wide variety of patients and people there. Our team of physiatrists is available for the whole province, and appointments can be both in person or virtual. It just requires a referral from your family physician, neurologist, or other physician. There's also a number of physiatrists that work in the community. These are my references. So now we have time for questions. Yeah. Oh, that's what I mean. Sorry, yeah.
Because I have some questions.
Oh, gosh.
This is great. No, that's really good. Thanks, I'm sure. But any questions here from the audience first, then we can get some. I know. Yeah, good. I do too.
You know I would, right?
No, you
So
go first.
I have a question about the sub-maximal exercise.
Yeah.
Because we all have had Pompe since we were born. It's genetic. So before I was diagnosed, I was going to the gym twice a week. I was not submaximal. Like, I was definitely higher than that. I built muscle strength. I did pretty well at the gym, actually. Never built core strength. That never happened. But everything else was quite good. So I'm wondering if there's a factor of disease progression where we should start to be more concerned about that. Like if we're diagnosed quite early, maybe we can do more, but then we should not all of a sudden, but at some point we should be more concerned about how hard we're working the muscles.
That's a very good point. Is this on? Yeah. I think maybe I was thinking about that as well, because I think in general, when we make the recommendations for submaximal, that's kind of on the basis of studies that have been done in specific populations, and we feel confident that this is safe because you've been in this monitored setting. If whether or not this relates to kind of the actual safety of doing exercise, they've monitored the CK levels they haven't seen, a dramatic elevation in some of the blood work that we look for muscle breakdown. But I think that's probably where it also comes back to really looking for those signs of overexertion, or kind of relying on the body's response to doing the exercise. So if you did maybe more than a submaximal, kind of getting into that maximal effort, but then you recovered without any issues from doing the exercise, I would be inclined to suspect that that's not causing harm. But I don't think we have kind of studies that have been done to say for sure that that's the case.
I guess it goes back to what you're saying of really individualizing it,
Yeah.
and for each person
Yeah.
is different. And listening to your body. I loved your scale of the 0 to 10. That's actually very helpful.
So following up on that a little bit, so in clinic, Dr. Mezei, when you see us, you're testing our body strength and so on, and is there any sign that you would see, this sounds weird, but that we're exercising too much?
Yeah, not from that power testing, no, because I'm pushing it to try to, distinguish between something that goes because there's pain there versus I'm just trying to get the best strength you can get out of all those muscles, because we use those scales that then Caroline enters into various databases to see how, this enzyme replacement is doing. So no, I don't think I'd see it from that manual testing that I'm doing, but it's more like listening to the patients, what their change in function is, or the pain. I think I'd look at pain a lot. I don't know, is that a good clue that I should be?
Yeah, I mean, I think pain can be pain can be, just like anybody, you got a rotator cuff tendinopathy, and that causes pain, which would be a bit different from the overworking kind of discomfort. But if you had widespread body aches and pains after exercise, that would be a fairly good, that would show that you've worked too hard. But yeah, so then pain would be a really helpful thing to monitor. So you want to, it's common to feel muscle soreness after exercise, but it's important that it doesn't last longer than we expect. So if it's lasting longer than 48 hours, that's a good indication that it was too high of an effort and too much exercise.
And that's when it gets really tricky, because then as people get weaker, not so much at the beginning, if people aren't that weak, but as they get weaker, you can't do a lot of, the exercises that are there. It's really a much lower level, but that's when they're prone to injuries. Mm-hmm. And I guess that's when I get concerned of, maybe I've been under-referring to physiatry, but I've sort of been only referring to, I know there's fewer of you than, needed around the province. So I guess my question would be, that overuse, if there's been, I certainly would like to catch it before there's damage, but I guess I'm usually catching it after somebody's pulled something or something. Mm-hmm. I don't know how to catch it before that. It's tricky.
Yeah.
But I guess that's why we encourage everybody, and that's what Seema was saying too. She showed the study of how, there have been studies showing that, maybe no benefit in exercise while you're doing the infusion, that Mark Tarnopowski did that study, but certainly there's been studies shown that people who have the right nutrition and the right exercise program, the enzyme works better. So.
Mm-hmm. Yeah, and that was something that I did not include in the talk, but something that came up with a number of the studies when I was reviewing for this talk, that it's very helpful to do both, like they're very complementary, the enzyme replacement therapy with exercise. Yeah.
And then it gets into the really tricky thing is, as you're able to have more challenges with exercise and then the nutrition, then there's the weight problem, so we're gaining weight, but it's not muscle weight, and we're getting, and then that's a whole challenge too, that is if there's too much weight, which is a really challenge when you can't do all the exercise, then that makes it harder to get around with somebody who has a myopathy or weakness too. So it's a vicious cycle.
I was going to ask if you have any recommendations with vibration boards. I hear a bit about it to help with core stability and exercise with Pompe.
Yeah, I don't.
That's Dr. Khan. So, some people in our audience have some experience with that with Dr. Khan. But,
I've actually had a few patients use them and actually get worse for back pain.
Oh, interesting.
If they already had back pain, it triggers something, that vibration is too much for those patients.
Yeah, Dr. Khan had some quite promising results with a lot of the sort of balance, and I'm not sure how he's doing it as opposed to other places, but we don't have access to it here in BC that I know of.
Yeah, it's not something I've come across. That's why I don't
Alberta.
have too much to add. But again, it's going back to being individualized. So if you do an exercise and it causes discomfort, that's not for you. It may be for somebody else, and that's okay for them, but then it's individualized. One thing I did mean to emphasize a little bit more is that strength training doesn't need to be bicep curling weights. Strength training and like we talked about with some of those isometric holds, and I heard that in this talk previously, you guys got bands for exercise, but just holding your arm up against gravity, that's strength training. It's individualized. It doesn't need to look the same as anybody else's strength training. It's finding that degree of submaximal or more, if your body responds well to that, level of resistance through the muscle and tailoring it to what works for you.
Which kind of leads me to the lack of resources business, because in the ideal world, like we would have all our patients would be seeing physio and then physiatry and everything. It's certainly with physio not being covered generally, but it's interesting to learn that in different health authorities, there's different coverage.
Yeah, it's challenging when, especially if people don't have access to private physio. If people have access to private physio, that's great. You can have very individualized, readily accessible resources. And then it is quite health authority dependent. And it's like some health authorities will say, oh, this diagnosis is more than 1 year old, so you don't qualify for coming for PT and OT. So those are things that are unfortunately out of our control, but probably worth looking into further to see how we can go back to that advocacy piece, because I do agree that it would be really helpful if we had more resources.
Yeah, because it kind of led to one of the questions that was here was, how does one know when they've exceeded, when they should try to pursue physiotherapy in general after the self-guided exercise programs? How does one know when to do that?
Yeah. Often I'm thinking about physio, again, for like a specific goal-based issue. So new shoulder pain as a result of X, Y, or Z, address shoulder pain. So they're diagnosticians and they also do treatment. And then probably in terms of progressing the exercise program, that would be just if you feel like you've really plateaued and you're not noticing further benefits or changes, that would be a good time to reevaluate.
Yeah, and sometimes certainly with this condition, it's not just plateauing, we're trying to slow down a progression, because our treatments, we're still a lot of unmet needs here. We're great, we have enzyme replacements, it's not the end answer, but with exercise, we're also trying to slow down that as well as prevent injuries.
Stop laughing at me. Okay. I'm wondering about pain management. I can tell you personally, for me, fatigue has been the top problem for years, but pain has superseded it. So pain for me is limiting my activity, and I know I'm paying a price for that. So I don't know what to do with that. I guess I know being in better physical condition is probably going to decrease the pain, but it's like a chicken and the egg thing, right? So I don't know how to get past that. I just don't know.
It's a very good point, a very good question. Sometimes coming back to, modifying that individual program. Oftentimes when people have pain associated with exercise, we recommend trying things that take gravity out of the equation. So things like swimming or getting in the water, getting in the pool and doing gravity eliminator or gravity reduced type exercises as maybe a starting point to be able to continue to progress with things, or trying to figure out and dial back on exercises such that you can find ones that don't, aggravate pain or increase pain when you're doing them. But it can certainly be difficult. And also just making sure there's nothing specific and treatable that's very focal with the pain.
Yeah, I understand pain from exercise. In my case, it's pain before exercise. Like the pain's already there. And the pain may be there because of functional problems and whatnot. I don't know, like I know I have back problems, so I know that. But it's keeping me from actually doing the exercise, which isn't good. Like I need to do the exercise, right?
Yeah, because the number one treatment for chronic back pain is exercise.
Yeah.
As you know.
Right. And I know from previous experience when I was much, much healthier, that even when I did exercise, my core strength just didn't improve. I guess that means that my core muscles are just past the point where I can actually really make a meaningful difference through exercise, I guess.
Or dialing back the core exercise, trying to do the core exercises in a way that you feel like you're trying to engage the core, but finding how that modification works for you can sometimes be helpful. So even if it feels like this isn't, challenging for the core, but if you feel a little bit of engagement in those muscles, just finding that way to modify it such that you can reach that point where you feel like you're getting activation of them. And I think that could, core stabilization is one of those things that's the most helpful for back pain too.
It's just such a challenge for Pompe because that is like those paraspinal muscles and the core is one of the first ones. We see that on the MRI before patients, even have symptoms. So it's really a chicken and the egg kind of story, isn't it? But you brought up one point about the fatigue and the pain, and you hinted at it. So we want to make sure we're not missing some other cause that has different treatment. So whether the pain is something else focal, like a tendinopathy that we can address, and the fatigue, also we want to make sure we're not missing something like sleep apnea, besides just blaming all on the chest wall. But
That is a good point. And also even just having a new onset of pain is worth maybe talking to your doctor about. So even just making sure that there's not investigations that need to be done or anything like that.
And with any of these things, everybody, as we get older, we don't want to blame all the fatigue on the Pompe. It's like any other condition. Oh my goodness, so we don't want to miss, age-appropriate malignancy or cancer screening. You have to make sure you keep up to date with all the other stuff without blaming everything on the rare disease that happens so often in every rare disease.
Right.
Yeah, that's a very good point.
Yeah, I did have a chat with Dr. Charnopolsky about it once, just recently, because I did that trial with him. And so I did ask him how many of his LOPD patients actually have back pain. And he said, well, pretty much all of them. So like it's that common, it's really common.
Yeah.
Yeah.
My husband is watching online and he sent me a question to ask. Okay. He asked, is the level of vigorous activity for kids much different than adults?
It's a good question. And I will say first that I don't regularly work with children. But we do have, if you look at the general exercise recommendations for children, they are different than adults because children aren't just tiny humans. So I am not able to kind of give you a solid specific recommendation for the exercise in kids because it's not something I do as regularly, but I'm happy to look it up for you if that's helpful.
Thank you. We're lucky in Ontario, we have Erin Oak kids. So my son gets physiotherapy, occupational therapy, all those things, and we don't have to worry about it. Like you said, different areas have different things. So he does get those things, but then how do you follow through at home? How do you know how much is too much? If he's done physio in a day, do I keep doing stuff? Like how much can I do?
Yeah, that's an excellent question, especially for a 3-year-old. Because it probably, I'm sure that they could be experiencing like discomfort, but not necessarily be able to communicate that. So that would probably be really helpful to have a good idea of what they're doing in physiotherapy. So then you can kind of try to gauge, did they already do 60 minutes of exercise today? Then I definitely don't want to be adding more to that. But if it was more, I doubt that the physiotherapy that he would be receiving is all passive. But if it was, then maybe you can add on. But I think that's where it would be good to have a very open communication around what they're doing.
Okay, thank you.
No more questions online? No? I want to thank Sarah very much. Really enjoyed your talk, and I think we can all learn from that. But thank you so much.
Thank you, everyone.